Welcome to Breaking Ground, where we're talking about some of the most fascinating and innovative healthcare programs in Lincoln, Nebraska. And it's always a pleasure for me to welcome some folks from our community to talk about those programs. And today it is Phil Tegler, the Executive Director of the Cornhusker Place. And Phil is here to talk with us about an interesting and innovative project that's been happening over the course of some time now. But we are just getting to the end and we have results to share with the community. And so I'm excited about doing that. But first of all, I want you to talk just a minute about Cornhusker Place for those people who might not know what it is.
Be glad to, and thanks for having me, Lori.
You're welcome.
Cornhusker Place is a substance abuse treatment center here in Lincoln. We're a licensed 68-bed treatment center, so one of the largest programs like ours in the state. Been in existence this year is our 30th year of service. Really a comprehensive treatment center, all the way from residential care to voluntary detoxification to a respite program, outpatient program, and then all of the services that really support recovery, like aftercare and alumni groups and all of those things that you really hope will provide some continuity for clients as they graduate from us and move back into the community.
Where are you located, so folks can kind of have that in their minds?
We're down in the South Haymarket area, 7th and K Street. Been there for 28 years now, providing services out of that building.
Good, and I know that that program has, or that building has undergone some renovations during your tenure. You're growing, you're improving your facility a lot.
We have done a lot, Lori. You know, as we get better at this process and learn how to be better in terms of providing care for clients, we've really tried to refunction the building to be able to support that care, and it's done well. It's really done well. It's an excellent location for us. It really serves our clients well. We're glad to be there.
Good. Well, we're going to talk about the Compass program today.
Good.
And the first question is, why is it called the Compass Project?
Well, Compass is really, the goal of the project is to really provide some guidance for the community in terms of the information we gained. When we started this, we really hoped that we'd gain data that would be able to provide a guide for the community in deciding how to use resources going forward. And so we thought Compass was a good way to do that.
Good, I like that name. So tell us what it is.
Well, the Compass Project is really based on the idea that most communities like Lincoln really struggle with how to find the data that supports decisions that they want to make, how to use limited resources to best address issues in the community. Lincoln, like a lot of communities, have struggled for a long time in getting good data on chemical use in our community. Alcohol and drug abuse and use and patterns among people that are using, and all those things that really substantiate how to really focus limited dollars on those issues in the community. So the Compass Project was really designed to try to provide, over the course of a couple of years, that consistent data to be able to use in the end to analyze those issues.
Well, I know that it is not easy to get data about substance abuse, either from the person who is abusing, from the folks who are around that person, from even within the service community. It's a tough thing. Sure. So I know there were some pretty innovative strategies put in place to get this data, and so I think people would be interested in knowing how you acquired this data at a time when perhaps it's been more difficult for other folks.
Well, that was one of the things, Lori, that we really wanted to accomplish. We hadn't been done in Lincoln before, and we wanted to end up with a project that people could look at and say, I trust this data, it's valid data, it was gained in a rigorous process, I understand how that worked. And so in the end, they could walk away with some support of the data and to be able to use it as it benefited their decision making going forward. There was a project that was done nationally called the ADAM Project, Adult Drug Abuse Monitoring, done in the early 2000s across 40 of the major cities in the United States. So think of cities like Seattle or San Francisco or Denver or Chicago. And the Federal Department of Justice funded this study to really analyze these same kinds of trends in those big cities. And they used a survey document that we felt was just excellent in being able to provide that same information from Lincoln. It's a very complex document. It's a really rigorous survey document. It's about 30 pages, and it really is focused on working with the study participant to gain that information from them. And so the first thing we did was to go out and secure from the federal government permission to use that same document. We really thought it would do two things. It would give us the ability to compare our data with some of that previous captured data, and second, it would confirm that rigorous survey process that would give people comfort in the data that we gained. The second thing we did, which was really one of the greatest parts of the study, is that we were able to go out and convince Nebraska Wesleyan University to be a partner with us in this project. Think of an academic institution and all they have to offer in supporting this, and we were very fortunate to work with Dr. Joan Gilbreth, from the Department of Social Work at Nebraska Westland, who really became the principal investigator on this project, and thought it would be good to be able to bring Westland students in as the surveyors on this project. And so we were able to use them, and together that partnership really added a lot of robustness to this survey process.
So you have a survey, and you have folks who are going to help you implement that survey. So tell me how you, and I assume from you're talking to me that you're going to interview, you're going to survey people about their alcohol and drug use.
That's right.
Tell me the environment you did that in, and what incentive did they have to tell you that information?
It's a great question. First of all, the national survey that this was based on, the concept was to go into these large cities and survey people that were being held in their jail facilities in the booking side of the jail, not the side where they were serving out a term for a crime, but in that early part where people would come and maybe stay for an hour or stay for 2 hours and then be released. And so the philosophy was that the people in those facilities are really a slice of the community, and that often people are there who would never come there again, who had maybe never been there before. It's not that hardened criminal that we often think about. And so we wanted to make sure we captured that population. But the other thing we had to do in Nebraska is make sure that we also looked at the civil protective custody population as well. Nebraska is a unique state. It's one of only about 22 in the country that offers civil protective custody as an alternative to incarceration for persons that are detained by law enforcement if the law enforcement officer thinks they're in danger to themselves or someone else.
Now, I want to ask you a question because I think this is a big point. Here in Lincoln, folks who are arrested for an alcohol-related offense, let's say driving under the influence, don't necessarily go to jail.
That's
a
correct.
lot of people don't know that.
Correct.
And how many of those folks will visit Cornhusker Place as opposed to the jail?
Well, last year we had about 5,000 admissions to our program, Lori, and what we found in this survey was that people that were surveyed were over 3 times more likely to be in our facility if they were there for only an alcohol or drug-related offense as in our local correctional facility. So really an excellent deterrent for the community, both to the jail system, to the court system, and a great chance to intervene with those folks and to try to make sure that whatever caused them to come to us doesn't happen again, so that they stay away from that system going forward.
Well, and I think that's something that is probably many people in our community don't know. I don't think they understand there is a facility like Cornhusker Place who not only takes these folks into custody who are arrested for these offenses, but then provides them the option right there on site to seek treatment.
That's exactly
which
right.
would not be available if they went to jail.
Absolutely.
So it's a great seamless kind of transition that many communities don't have.
That's exactly right. You know, we offer that, as I said earlier, that whole range of services. So some of them that we see in protective custody can then be offered the opportunity to stay and go through our detoxification program. Our staff are very focused on looking at treatment options for them, and so the whole array of potential services is available to those folks as a part of that entry point through protective custody.
So you interviewed folks in your facility in detoxification services or at the jail on the booking side. How many folks did you interview?
We ended up doing 632 interviews over the course of 3 years.
And those folks agreed to do this because you asked? Because?
Well, part of it, Lori, was in the setup. And so one of the beauties is we worked with these students to really determine how they would present themselves to people that were there. It was all voluntary. It's a clinical research project. And so we had to do all of the training for the interviewers to help them understand how to present the interview, to make sure nobody felt coerced to do that. In fact, it's interesting, we had to offer them a reward for being involved, and the reward was either a Hershey candy bar or a packet of crackers. That's it. That's all they got for being involved. Nothing about their sentence would be impacted, or they would get released earlier, or there'd be any monetary reward or any other impact. And so the first thing we did was really worked with the surveyors to decide how to present the information. Then the person had to say yes or no. Would they agree to be involved in the process? They understood the reward. We really presented it as you're going to help the community better learn about these issues. And we ended up over a 3-year period with over 600 interviews that really provide some depth in terms of those issues in our community.
Well, and that's what we're here to talk about. We've kind of set the stage for how you got this information, and now I want you to tell us some of the really key pieces of information. I think the community would be fascinated to know how these folks who are impacting our system, or how these folks who are suffering with perhaps a chronic or an acute abuse situation, what they're telling the community about their particular alcohol and drug history.
Right.
So give us some information.
Some great information. Let's start from the beginning. One of the things that really surprised us, 650 people in these two populations, and oftentimes people would think of these as they conjure up a notion of what these people represent. Well, first of all, over half of the people that we surveyed reported that they were in full-time employment, either as a part of being in the correctional facility or in protective custody at the time they were detained. So often people would say, I can imagine this person is probably not employed, probably just out in the community. In fact, they're gainfully employed. Another interesting part is that even though most of these people were employed, either full or part-time, over 70% reported having no access to health insurance. So when people say, well, I'm imagining if they're thinking about treatment, they can just use their insurance to gain treatment. And in fact, they can't. Didn't have access. We know that corroborates national statistics that say that private insurance today pays for only about 10% of alcohol and drug treatment. And so that's really what these people are facing as well. No access other than perhaps government funding to seek treatment. But beyond that, the data about their chemical use was really impactful. There'll be a slide, for example, that we show in presentations in the community. One of the questions that was asked is, when was the first time you were involved in an episode of binge drinking? And as you see that slide, it really is a graphic of a whole range of different columns, heights of people that responded positively over the course of the 6 data collections, 2 a year over 3 years. And so what's amazing is when you divide that range of ages up, people often say, well, I'm going to bet the first time somebody was involved in an episode of binge drinking was maybe when they were 18 to 21 years old. You know, you're graduating from high school, entering college. And in fact, the data from these folks said the first time they were involved is a lot earlier than that. 15 to 18 years old. In fact, the second highest category was 12 to 15 years old.
And I think this is a critical point to stop and mention to people who might be watching, that if you have a young adult or a 15 to 18-year-old who is doing binge, who's participating in binge drinking, that in fact that can lead to incarceration, it can lead to detoxification. It immediately sends up a red flag that early drinking can lead to interactions with law enforcement and things at a later time.
In fact, some of the data that we collected, Lori, really confirms that. So at least in this trend, and in Lincoln, Nebraska, that's a statistic now that we have some weight to stand behind. And so if you think about people that are involved in drinking, and this slide talks about data, not only when did they begin to use alcohol, but when was their first episode of binge drinking? Nationally, the definition of binge drinking is 5 or more drinks if you're a male, or 4 or more drinks at one setting of female. And so when you talk about the first episode of binge drinking being at 12 or 13 or 14 years old, it really says to us as a community, we need to start thinking about that much earlier maybe than we would have in the past. So a great finding right there that was kind of surprising. The second was about marijuana use. We asked the same question about marijuana use. And in fact, the use graphic is a bit more dramatic than that about binge drinking. That 75% of the folks that were surveyed said that they used marijuana before they were the age of 18 years old. And in fact, over 80% of that 600 people we surveyed reporting that they had used marijuana in addition to alcohol. So when we think about drug use in the community, marijuana was a lot more prevalent in the people surveyed than we would have thought, and their age of first use was a lot earlier than we would have thought as well.
And one of the things that you mentioned to me was this is great information for police officers to have. Say, for example, a minor is arrested for drinking or drug use, and they take that child back to the primary residence. This sends immediate message to parents that this early use is really a precursor to perhaps illegal activity and great impact on this person's productivity and life moving forward.
And the other beauty of this project, Lori, is that it's local data. What we often hear from professionals in the community is that they have to end up using national data to a local basis when they make presentations to parents, for example, or concerned others. And so what we heard from the community is they really appreciate the fact that this is local data. This isn't from national data that's brought down. This is Lincoln, Nebraska data. And so when you talk about that, it is pretty impactful. We talked to school professionals who said, we were really tickled to be able to use this data when we talked to parents of students. about concerns that they need to think about. And when parents would say, for example, in middle school, I'm glad I don't have to worry about chemical use until my son or daughter's in high school, this data says that's probably not the case.
Yeah.
That we ought to be thinking earlier on about having to build those messages into our curriculum and our activities with students, for example. And law enforcement's another great example.
Yeah. Any last bits of data, information, messages that you think can be sent to the community because of this project?
One other interesting thought is, people often say that, I bet it's a lot different for men than women, or for young males from young females. Our data didn't say that. Our data actually said, Lori, that the age of first use for chemicals was really about the same. Maybe males at a very young age started to use alcohol a bit earlier, but females caught up fairly quickly. And for marijuana, there was really no difference. So the data really says that there's a lot we can look into here to have value back to our community. And so what we've tried to do, since we've now got this data to begin to promote it in the community, is to say we have a wealth of information here. There are many stakeholder groups that can benefit from this. And we've done a lot so far to begin to take this out. But if people are interested, they can go to our website. They can call.
You want to give that website now?
I'd be glad to. It's www.cornhuskerplace.org. And so they can go out to our website, get information on the study, call us back for more information. We'll be glad to come out and do a presentation to share the data. That's really what it's for. The goal now is to get it out and let the community begin to use it. A wealth of information here that the community can make use of.
Perfect. Well, thank you for all your work. I mean, any project that goes on 3 years where it's really intense and it has to be process oriented, it's not easy. So thank you for carrying this through from beginning to end, working on a tough subject in a tough environment. But here we are at the end where we now can reap the benefits of all of your hard work. Folks in this community can use this information to make good choices about programming and funding. And so thank you on behalf of all of us for your work.
Thanks for the time to come here and talk about it today, and we hope the community makes use of it. Thank you, Lori.
Good. Well, thank you for joining us today, where we hear about another project that's going on in our community that many may not be aware of, but many folks need to know about, and that is the Compass Project at Cornhusker Place. Thank you for joining us, and we look forward to seeing you again on Breaking Ground.
I began my recovery at the bridge at Cornhusker Place. The staff, quite frankly, saved my life.
They have all shown me love, something I haven't seen much before.
Getting sober isn't just about me. I'm putting my family back together.
The bridge at Cornhusker Place allows men to safely make the journey away from their addiction. Men who pass through the bridge come out the other side as stronger men, more prepared to live a sober life. Learn how you can support these fathers, brothers, and sons by visiting www.cornhuskerplace.org.